MMSF stands for Manitoba Medical Service Foundation. So it's a foundation, a not-for-profit foundation, which is set up to fund and promote health research and education in the province of Manitoba, with a focus on young investigators, young researchers. The ultimate aim is to improve the health of Manitobans. MMSF and Manitoba Blue Cross grew up in parallel, actually, before they were each incorporated as present organizations. So 1971, Manitoba Medical Service Foundation was actually incorporated as an act of legislation. So the foundation was created. But before that, people who had been involved in the creation of MMSF had actually been involved in the health insurance business. That's what Manitoba Medical Service stood for. It was actually a health insurance company. So the history goes way back for 1971, but it's continued ever since.
We've been partnered with the MMSF for a number of years now. We are their primary source of funding. I think since we started in around 1971, I think we've donated to them a bit over $10 million.
MBC is really the supporter for Manitoba Medical Service Foundation. In many ways, we have some direct funding support on an annual basis. They give us a grant, and they provide us with a physical home for our meetings, for our administrative assistant. And the administrative assistant is actually part of the administrative team of Manitoba Blue Cross. But beyond that, we get assistance in governance, in IT, in communications, and legal, and in other areas that give us guidance for our investments, for example. So there's a very overall approach that Blue Cross takes to support our direction. One of the most important things about research is starting it. It's sometimes overwhelming to consider trying research, but until you've tried it, you don't know if you like it or if you're good at it.
MMS funding was critical. It was the first grant I got, was $21,500, and it allowed me to measure, I think it was 200 breast milk samples. I had about 3,000 of them in the freezer, so I could not afford to do them all, but I said, I'll get started. So I measured two things, hormones and fatty acids, in these 200 samples. And nowadays, the types of grants I'm getting, so that was $21,000. The last grant I got was $3.2 million, right? And I'm studying thousands of breast milk samples, not just from Canada, but from Burkina Faso and Pakistan and England. And I've got a project in Kenya. And like all of this trickles back down to those very first grants, like each one builds on the next.
MMSF funding is critical for young investigators, and I was no exception. It really is sometimes the very first grant that a new investigator will get of significant dollars. And it really, justifies in their own mind that, yes, I can do this. I can be a researcher. I can compete for grants. And it really validates their decision to become a researcher and get that early confidence to go on and to get more grants and do more things.
I was really fortunate to receive the clinical professorship in population health from MMSF in 2010. And at that time, I had just wrapped up a postdoctoral research fellowship where I had been working in South India, where our university had just begun engaging in HIV prevention programs there. And so I proposed for my for the application to sort of do some work that was linked to work I'd been doing in India at the time, but also linked to some work that I was just beginning in Manitoba. So while India and Manitoba are quite different contexts, there's always lots that you can learn when you're thinking about public health programs and thinking in this context for HIV and STI prevention or care programs. So for HIV prevention, across those different contexts, a lot of the work that we've done has been taken up to inform policy. So we've had the opportunity to engage with national or state level governments that are designing or implementing HIV prevention programs or STI prevention programs. And some of the research that we've done has informed how those programs get rolled out.
Our research is wide ranging. We do a lot of work in Nairobi, Kenya, but it has a lot of implications back here in Manitoba. Actually, it's sad to say that in this past year, there's been more new HIV infections in Manitoba than any time during the HIV pandemic. So we need new prevention approaches, and working with our local community is really essential. And some of the skills and approaches that we've developed in Kenya working with communities, something called a peer educator model, are now being used in in Manitoba by many different people. And Dr. Zuma Rueda is a new faculty member in our department, and she got MMSF funding and is focusing on working with Indigenous communities here in Manitoba to learn about HIV and other sexually transmitted infections. So I think there's a lot that we can learn from other places, and a lot that the global community can learn from what we're doing here in Manitoba. I mean, infectious diseases don't respect borders, and therefore our ability to work across the world makes Manitoba not only I think a leader in the field, but also is better for the health of Manitobans.
My research is about the wellness of public safety professionals. When I say public safety professionals, I mean police officers, correctional officers, communicators like the 911 folks. So recently I got a grant from the Manitoba Medical Service Foundation to expand my research on communications. So more specifically 911 folks here in Manitoba. So I'm interested in their occupational wellness. And I kind of, when I think about like people's wellness at work, I take a very holistic kind of perspective. Like I think about their money, if they're happy with that, about community support that they get, about like any kind of support that they get from the employer for their physical health, mental health. So I look at that. And I also try to understand how they cope with, I try to understand their stressors and also how they cope with the stressors. And that knowledge that I create through my research, it can help us improve like work conditions for communicators. And that is really important because, you know, the quality of work conditions is directly associated with the quality of service that they provide to the population.
So I think our research is helping Manitobans and the greater community at multiple levels. So the Pump Loan program is an example of like helping individual Manitobas right now today. There are moms out there who need a pump and they're able to get one through this program. But the bulk of the research I do is actually more this complicated, like what's in breast milk, what's in the molecules. And that's maybe not as directly translatable today, but I think that research has huge potential to affect policy, practice, products, right? So the more we understand about breast milk and what is it in there that's so important for the microbiome or brain development or lung development, we can use that knowledge to help babies. Seeking money from the MMSF early on is a no-brainer. Like it is a small pool. It's for early career.
We are very lucky to have provincial funding organizations like MMSF. I don't know that everybody has that. And so it's a great place to be able to obtain some funding from. I think that, if I think back on the award that I received, it was so transformational in terms of being able to provide protected time to do the research. And so I think that it presents an amazing opportunity to get started and to sort of begin building your research program.
When I have new faculty members come into the department, I say that MMSF grant is something that they have to apply for in their first year because it's that first domino that's really going to set them up for their success.
We have, over time, donated and given out $25 million in health research and educational funds for all of these programs over the years. So we hope to continue to growing those funds. We're one of the most stable granting organizations at a time when we find a lot of changes in national science research funding. So that's why we're an important organization for the startup funds and for the continuation of research for people over time. And we did an economic analysis as well. And we found out that for every dollar we put into research grants, the people within 5 years of getting their grants acquired $9, bringing back to Manitoba from external national funding organizations like CIHR, NSERC, and SSHRC. So there's a very good economic return for our investment, and while all the time building the careers of the new investigators and young researchers that we aim for.
To be able to provide funding to an organisation that improves the health and well-being of Manitobans, which is our objective, that's actually an honour to be a partner with the MMSF.
I think MMSF is a wonderful organization. They throw a very nice reception for the candidates and sort of celebrate their success. Other times you just get a letter in the mail, congratulations, you received a grant. But here they highlight the work of the candidates. They read out the work that they're doing. There's posters up that's explaining. It celebrates them at a time when they're maybe a little bit insecure about moving into this new field. And MMSF is very reassuring. So I encourage everyone to apply within the first year or the second year that they're new faculty members.